child with special needs. Under this, today we are going to deal with neurological impairment, which can also be called as cerebral palsy. The objective of this lesson is to impart knowledge on basic issues concerning cerebral palsy, the classification, types, characteristics, etiology or causes. The second objective is to plan interventional programs for children with cerebral palsy. That is, the knowledge about diagnosis, treatment, management, therapies is very much needed for planning the interventional strategies. What is cerebral palsy or neurological impairment? It is a group of chronic disorders impairing the control of movement that appears in the first few years of life and generally do not worsen over the time. These disorders can be caused by faulty development or damage to the motor areas in the brain that disturbs the brain's ability to control the movement and posture. It is a purely motor coordinating deficiency. This can be mild, as in minor loss of a muscle control like the clumsiness in the hand or leg movement, or sometimes it can be severe, as in the total loss of muscle control with which the person is not being able to walk or swallow or speak. The damage to the brain is permanent and it cannot be cured, but the consequences that can be minimized through medical intervention and appropriate therapies. Let's know in detail what is a cerebral palsy or neurological impairment. Concept. The term cerebral refers to the brain. Brain has two halves or hemispheres. Palsy means a disorder or any disease that impairs the control of body movement. Thus, these disorders are not caused by the problems in muscles or nerves. Instead, a faulty damage or development into the motor areas in the brain disrupts the brain's ability to adequately control the movement or posture. Therefore, the children with cerebral palsy or neurological impairment might have problems with motor skills, muscle tone, muscle weakness, reflexes, balance. A group of permanent disorders of development of movement or posture causing activity limitation that are attributed to non-progressive disturbances that can be occurred in developing fetal or infant brain. The motor disorders of the cerebral palsy are often accompanied by disturbances of sensation, perception, cognition, communication and behavior, by epilepsy and by secondary musculoskeletal problems. Obviously, this is a clinical definition, meaning that cerebral palsy is a condition in which there are abnormal brain development or injury to the brain as it develops. This can occur before or during or after birth or during the childhood also. Children with cerebral palsy have difficulties in controlling the muscle and movements as they grow and develop. The nature and the extent of these difficulties may change as the child grows, but cerebral palsy itself is not a progressive disease. The injury or impairment in the brain does not change. However, the effects of brain injury on the body may change over time for better or maybe worse. Physiotherapy and other therapies can often help people with cerebral palsy reach their full potential and become more independent. Therefore, children with cerebral palsy often be referred to a therapist. Depending on the precise area of brain that is affected, there may be associated difficulties which become obvious during the development, for example, in vision, hearing or learning. Cerebral palsy is not contagious, nor is it usually inherited from one generation to the next generation. It is a permanent condition that affects the movement. It occurs before or during the birth or after the birth, mostly during the first early years of the child. Babies most at risk cerebral palsy are those who are born prematurely or those babies with low birth weight. Cerebral palsy or neurological impairment can be mild, moderate or severe. Mild cerebral palsy means a child is clumsy. Moderate means the child may walk with a limp. He or she may need a special leg or brace or a cane. More severe cerebral palsy can affect all parts of the child with physical disabilities. A child with moderate or severe cerebral palsy may have to use a wheelchair or any other special equipment. There is no cure for cerebral palsy, but treatment, therapies, special equipment, in some cases surgeries also can help the child who is living with this condition. Now, having understood what is cerebral palsy, let us see the prevalence of cerebral palsy in India. The incidence of cerebral palsy or neurological impairment in the country is 3 per 1000 live births. The rate has remained the same for more than 2 decades as more and more low birth weight babies are surviving with the help of advanced technology, and they are the ones who are more susceptible to having the cerebral palsy. Now, after knowing about the prevalence, let us try to classify the cerebral palsy. There are 3 main types of cerebral palsy which involves the way a person moves. The movements are unpredictable. The muscles can be stiff or tight. In some cases, the people can have a shaky movements or tremors. Cerebral palsy affects the muscle control and coordination, so even the slightest movement like standing still is also difficult for these children. Spastic cerebral palsy. This is a common type of cerebral palsy. Spasticity means stiffness or tightness of the muscle. This is the most common type, affecting 70 to 80% of the people with the condition. The 4 commonly diagnosed spastic cerebral palsy are hemiplegia, diplegia, quadriplegia and monoplegia. Hemiplegia, that is difficulty moving using one side of the body. The arm is often more affected than the leg. The affected side can be smaller due to the tight muscles and lack of growth. Neglect of the affected side results in lack of use. The next condition is diplegia. They have difficulty moving the lower part of the body due to the stiffness of the legs. They have difficulty straightening fully at the hips. They have difficulty with the balance when standing or walking. The next condition is quadriplegia. All the 4 limbs are affected in this condition. The trunk, neck and often head is also affected. The person often has problems controlling the mouth and tongue muscles. Individuals generally are unable to walk, either they have extreme difficulty in their fine motor tasks also. They can also develop curvature of spine or hip dislocation, bladder and bowel problems also. The last type is monoplegia. Mono means one, that is only one limb is affected in this condition. The next classification is dyskinetic. This form of cerebral palsy is characterized by uncontrolled slow breathing movements. These abnormal movements usually affect the hands, feet, arms or legs, and in some cases the muscles of face and tongue also, causing drooling effect to the child. This type affects 10 to 20% of the people with cerebral palsy. Again, there are 2 forms. Athetosis, it is characterized by uncontrolled slow and stormy movements. Dystonia, it is characterized by sustained or intermittent muscle contractions causing twisting or repetitive movement. Ataxic cerebral palsy. This is the least common type of cerebral palsy and is characterized by shaky movements. It affects the person's balance and coordination. The affected persons have poor coordination and walk unsteadily with a wide-based gait, placing their feet usually far apart. They may also have tremors. The ataxic form affects estimated to be 5 to 10% of cerebral palsy patients. Mixed forms. Many people have the signs of more than 3 types. The most common mixed includes the spasticity and dystonic movements, but other combinations can also be possible. It is common for the patients to have symptoms of more than one of the previous 3 forms. The most common mixed form includes spasticity, athetoid movements, but other combination can also be possible. So, after having understood what are the different types of cerebral palsy, let us now try to see what are the problems associated with the cerebral palsy, the medical disorders associated with cerebral palsy. Mental impairment. About 1/3 of the children who have cerebral palsy have mild intellectual impairment, and 1/3 are moderately or severely impaired, and the remaining third are intellectually normal. Mental impairment is even more common among the children with spastic quadriplegia, seizures or epilepsy. As many as half of the children with cerebral palsy have seizures. Tonic-clonic seizures generally causes the patient to cry out, followed by loss of unconsciousness, twitching of both legs and arms, and convulsive movements. Partial seizures. They can be classified as simple or complex. In simple partial seizures, the individual has localized symptoms like muscle twitching. In complex partial seizures, the individual may hallucinate, stagger, and perform automatic or purposeless movements. Growth problems. A syndrome called failure to thrive is common in the children with moderate to severe cerebral palsy, especially those with spastic quadriplegia. Impaired vision or hearing. A large number of children with cerebral palsy have strabismus, a condition in which the eyes are not aligned because of difference in the left and right eye muscle. In an adult, this condition can cause double vision. Abnormal sensation and perception. Some children with cerebral palsy have impaired ability to feel simple sensations like touch and pain. Intellectual disability and learning difficulties. Children with cerebral palsy vary widely in their intellectual or learning capabilities. Perception difficulties. Perception is making sense of information gained from the senses. This enables the people to do things such as move around the obstacles, judge the size, shape of the objects, understand how the lines are connected to form letters. People with CP, that is the cerebral palsy, can have problems with perceptions as the brain may have difficulty interpreting the messages it receives from the senses. Speech difficulties. Because the muscle of the mouth may be affected, sometimes the people with cerebral palsy may find talking difficult. Some people may be mildly affected while others cannot say even a single word. Eating and drinking difficulties. Cerebral palsy may affect the muscle that open and close of the mouth, and the movement of the lips and tongue will be a problem. Some children have difficulty even in chewing and swallowing certain foods. Characteristics. What are the characteristics of a child with cerebral palsy? The predominant symptom or the sign of cerebral palsy are related to the motor difficulties, which are consequence of the brain damage. Many signs and symptoms are not readily visible at the time of birth, except in very severe cases, and may appear in the first 3 years of life and as the brain and the child develop. Some of the characteristics are failure to reach the developmental milestones like holding the head, rolling over, sitting without support, smiling, crawling, walking, holding a thing. Different forms of cerebral palsy have different symptoms depending upon the area and the extent of damage done to the brain. Very often, the muscle or the arm of leg remains small owing to an injury or underdeveloped nervous system. These muscles do not allow the person to fully use his limb, and this inactivity affects the growth of the limb. Some symptoms become more obvious over a period of time, like feeling pain even when touched very lightly, as in brushing of the teeth. Because of some abnormal sensation, the child may not be able to use his sense of touch to tell the difference between the things by touching them. Although cerebral palsy does not affect the person's intelligence, the associated symptoms like retardation may lead to a range of intellectual functioning from bright to normal to severely retarded. The child with cerebral palsy also has difficulty with fine motor tasks such as writing, cutting with scissors, experience with trouble maintaining the balance, walking, or be affected in involuntary movements, such as uncontrollable writhing movements of the hands or sometimes drooling also. Cerebral palsy occurs due to damage to the areas of brain that direct the movement, interfere with the brain's ability to control the movement and posture. Cerebral palsy may develop before, during, or after the birth. The damage may occur to the brain. In the early months of pregnancy, for example, if the mother is exposed to infections like German measles, then there is a chance that the child can be a cerebral palsy. Baby not growing at a correct rate during the pregnancy can also lead to a cerebral palsy. At any time, if there is lack of oxygen supplied to the baby, it may also lead to cerebral palsy. In the period shortly after the birth, if the infant develops a severe infection like meningitis or encephalitis, which in rare cases can result in damage to the brain, which occurs cerebral palsy. Accidents like drowning or a car accident can also lead to cerebral palsy because of injury done to the brain. There are two types of cerebral palsy: acquired cerebral palsy and congenital cerebral palsy. Acquired cerebral palsy, it results because of the damage done to the brain in the first few months of the life or few years of the life, and can follow the brain infections such as bacterial meningitis or viral encephalitis, or may result because of the head injury causing damage to the brain. Congenital cerebral palsy, on the other hand, is present at the birth, although it may not be detected only after few months. Some of these causes of the congenital cerebral palsy are infection during the pregnancy, jaundice in the infants, RH incompatibility, severe oxygen shortage in the brain or trauma to the head during the labor or delivery, stroke. What are the risk factors? Certain characteristics are called risk factors that increase the possibility that a child will be later diagnosed with cerebral palsy. What are these factors? 1. Breech presentation. Babies with cerebral palsy are likely to present the feet first instead of their head at the beginning of the labor. Complicated labor or delivery. Vascular or respiratory problems of the baby during the labor or delivery may sometimes be the first sign that there may be a damage done to the brain. Low Apgar score. Apgar score, named as like the rating or the numbering that reflects the newborn's condition. To determine Apgar score, the doctors periodically checks the baby's heart rate, breathing, muscle tone, reflexes, and skin color in the first few minutes after birth. Then they assign points. The higher the score, the normal the baby's condition. Low birth weight and premature birth. The risk of cerebral palsy is higher among the babies who weigh less than 2.5 kgs. Multiple births. Twins, triplets, and other multiple births are related to the increased risk of having cerebral palsy. Nervous system malformations. Some babies born with cerebral palsy have visible signs of nervous system malformation, such as abnormally small head circumference or microcephaly. Maternal bleeding. Vaginal bleeding in the 6th and 9th month of pregnancy and severe presence of the excess proteins in the urine can also be linked with the higher risk of the baby having a brain damage. Maternal hyperthyroidism. It may also cause a child with cerebral palsy. Seizures in the newborn baby. An infant who has seizures faces a high risk of being diagnosed later in the childhood with cerebral palsy. So, after knowing about the causes, let us see the prevention. What are the preventive measures of cerebral palsy? Head injury. It can be prevented by regular use of the child safety measures. Jaundice. Jaundice in newborn can be treated by phototherapy. RH incompatibility. It is easily identified by simple blood test routinely performed on expectant mothers. rubella or German measles. It can be prevented if the women are vaccinated against the disease before and after becoming pregnant. What are the diagnoses that can be taken in the case of cerebral palsy child? Doctor diagnosed cerebral palsy by testing the infant's motor skills, looking carefully at the infant's medical history, abnormal muscle tone, poorly coordinated movements, and the persistence of the infant reflexes beyond the age at which they are expected to disappear can also be the signs of the child having cerebral palsy. In addition to checking the reflexes, if a newborn baby held on its back and tilted so the legs are above his head, the baby will automatically extend its arm in gesture. This is called as Moro reflex. That looks like an embrace. Babies normally lose this reflex after they reach 6 months. But those children who are with cerebral palsy may retain it for abnormally long periods. The doctor may also order special tests to learn more about the possible causes of cerebral palsy. One such test is tomography or CT scan, a sophisticated machine technique that uses X-rays and a computer to create an automatic picture of the brain tissues and structure. And magnetic resonance imaging (MRI) is a relatively new brain imaging technique that rapidly gaining widespread use of identifying brain disorders. A third test that can expose the problems in the brain tissue is ultrasonography. This technique bounces the sound waves of the brain and uses the pattern of the echoes to form a picture of sonogram. When the doctor suspects a seizure disorder, an electroencephalogram (EEG) may be ordered. An EEG uses a special patches called electrodes which can be placed on the scalp to record the natural electric currents inside the brain. So, these are some of the diagnoses that can be done in a CP or cerebral palsy affected child. Treatment. As we said earlier, there is no treatment to cure cerebral palsy. The brain damage that causes cerebral palsy is irreversible. Early diagnosis, immediate therapy will help to reduce the impact of the disability. The services that can be given to the cerebral palsy child are physical therapy. Physical therapy helps the child to develop stronger muscles such as those in legs and trunk. Through physical therapy, the child works on skills such as walking, sitting, and keeping his or her balance. Play or occupational therapy. It helps the child develop fine motor skills such as dressing, feeding, writing, and other daily life activities. Speech and language therapy. It helps the child develop his communication skills. The child may work in particular on speaking, which may be difficult due to the problems with muscle tone of the tongue or throat. Adaptive devices. In addition to the therapy services and special equipment, children with cerebral palsy may need to have what is known as adaptive or assistive technology. The examples of assistive technology are communication devices, which can range from simple to sophisticated. Communication boards, for example, having pictures, symbols, letters, or words attached. The child communicates by pointing to or gazing at the pictures or symbols. Computer technology. It can range from electronic toys with special switches to sophisticated computerized programs that can be operated by simple switch pads or keyboard applications. The other services include medication, drugs that help to control muscle spasms and seizures, surgeries. Certain operations may improve the ability to sit, walk. Physical aids, braces, splints help the knee limbs in correct ailment and prevent deformities. Special education. Programs designed to meet the child's special needs may improve their learning. Rehabilitation services. Speech, physical and occupational therapies may improve the ability to speak, move and walk. Family services. Professional support helps the patient and the family to cope up with cerebral palsy. So, These are some of the services that can be given to a cerebral palsy child. Today we have learnt about a child who is affected with cerebral palsy in the topic child with special needs. We have understood the concept of cerebral palsy, that is injury done to the muscle of the brain which affects the motor or the movements of the child, and then we try to understand the classification and the causes of cerebral palsy. Next, we have seen what are the diagnosis tests that can be done by a doctor for a cerebral palsy child. Then we have understood what are the preventive measures and services available for the cerebral palsy child or neurologically impaired child. Hope you have understood the lesson. Thank you.